Well, according to the Centers for Disease Control, 40% of us Americans have put off healthcare during the COVID pandemic. It can make you feel a little bit anxious going to the doctor's office. And yet, at the same time, we're more aware of the importance of our health than ever. Well, put health into your own hands, and you can do that right here in the Valley at Preventative Diagnostics.
It's really incredible technology that they have there. Dr. John Pierce is joining us, the medical director of Preventative Diagnostic Center, joining us now from his office with more. How are you, sir?
Excellent. How are the two of you today?
Doing very well. Doing very well. Well,
Good.
let's talk about this. I mean, you're offering something that has literally saved lives locally. Tell us exactly what it is that you offer and who this is for.
Well, what we're offering is a CT scan, basically from the neck down to the groin if you want to do a whole body scan, or we can just focus on the heart or the lungs or a particular area. The idea behind this particular scanner is that it really only gives the minus or the smallest amount of radiation necessary for the size of the patient. So it actually looks at the size of the individual and gives them the exact dose of radiation to get the most defined and clear images, so much so that we can see any abnormality down to about the size of a grain of rice.
Hmm.
And with that, we're able to really look at all the systems. But in the heart, we're looking at the coronary artery. So we can see if coronary artery disease is present long before someone exhibits signs of coronary artery disease, which typically exhibit as a heart attack.
Wow.
We can see lung disease, scarring in the lung. We found little what are called ground glass opacities, which can be very normal, but in other circumstances, they can be a sign of an infection, a sign of lung cancer. We found some lung cancers in some individuals long before they had any symptoms, and early on with any type of cancer prognosis. The earlier the prognosis, the better, earlier the diagnosis, the better the prognosis.
Wow.
So we're able to see a lot of things early on, better than what a lab test would show, and help people be proactive with their health, and get into a treatment if need be, long before they develop any problems.
It is about being proactive. It's about being safe, like you mentioned. It is a safe test. It's also very convenient. I have done the test, doctor, as you know. I went down to the center just off the 215, and Sean, you know the cross street
Mm-hmm.
because it's right
Right
by
near the radio
you.
station. Yeah.
There you go, right by Mix. And I had a very easy experience. It is not a test where you're going to be inside like a tomb-like structure where you feel claustrophobic. There's no pain, there's no needles involved. In fact, it's kind of like a cute little donut, and it takes less than 5 minutes. It's really quite easy. So it's amazing that it can do such a profound reading on your health.
Well, the scan itself generally takes about 20 seconds. The rest of the time is kind of, getting in, laying down on the table. I think it takes longer to lay down
Yeah.
on the table and get comfortable than it does to do the scan.
Well,
Right.
that's good. The easier it is, the better. And the thing is, while it's easy, it's incredibly important. I mean, heart disease is the number one killer in America. And wow, this thing seems to be able to pick it up pretty quickly.
Well, yeah, and as you guys alluded to in the beginning of the show, we have people that have, out of fear, experienced symptoms of heart attack, and fear of developing or contracting COVID made them stay home, and they actually died from their heart attack as opposed to going to the emergency room
Yeah.
and getting taken care of, because their fear of getting COVID and possibly dying from COVID superseded that of dying from a heart attack. And unfortunately, either event, people have died. Where coming someplace like preventative diagnostics, we're doing social distancing, everybody's wearing masks, we clean everything every day and in between patients as well. So we've been very proactive in that approach. And then people can take charge of their own health, and they don't need to put it on the back burner out of fear of getting a virus that can be very deadly. But for most of us, if we get it, we'll do fine. But the bottom line is we're taking the steps to keep it so that fear is alleviated and people can actually be more proactive and feel comfortable doing so.
Mhm.
Mhm. Yeah, absolutely. Oh, thanks, Sean, giving it back to me, because I have had the experience of doing the scan. So I understand, doctor, the importance of peace of mind, and I know that in addition to having individuals across Las Vegas come in and get the scan, you have a lot of couples that come in, and maybe you can speak to the recommended age that the scan benefits as well.
So typically, we're looking for people that are in between the ages of about 40 to 75.
Mhm.
Generally, when we hit 40, and for those of us that have done it, and for some of us it's been a few years ago, we notice that some issues start rearing their ugly head, and that happens both physically, that we can feel it, and also internally. And so again, we're able to see these things long before symptoms develop. Then up to 75, and we make some judgment calls on older patients as well, because we're seeing an older population that has taken charge of their health throughout their life. They're much healthier, their life expectancy is a lot better. And so if we find something in them, and somebody's, let's say, 80, who's in really good health and has another 10, 15 years of life expectancy,
Mhm.
they want to take care of it, and they want to be, again, preventative, proactive.
No question.
Yep.
Really quickly before we go, you were offering a really, really great offer for somebody that wants to get a look at maybe their heart and their calcium score as well.
Right. So a couple can come in and get that coronary artery scan done. It's looking at the heart and the coronary arteries, and they're given a calcium score. And it's $125 for the couple.
Wow, which is great.
Yeah,
Usually
typically we charge
$5.99 for one.
$5.99, right?
Yeah, that's pretty great. It's great
Dr.
having you,
Pierce,
doctor.
thank you so much.
No, it's our pleasure. Thank you.
All right, take advantage of that special offer. Call them right now, 702-534-7900, or go to pdcenterlv.com. Preventative Diagnostic Center, a proud sponsor of the Morning Blend.